media has been scrambling to remove it, but there's been warnings out there that it could still pop up on your social media sites. So to help us talk about this difficult topic, what to look for, and more importantly, how to reach out if you need help or someone you think may need help, we're talking to Dr. Andrea Raby. She is the Vice President of Psychiatry at Bayless Integrated Healthcare. Thank you so much for joining us this morning, Doctor.
Thank you, Tess. I appreciate it as well. Thank you.
It is such a difficult to talk about. It's almost taboo for a lot of people. Where do you even begin if you think someone you know needs help, or you yourself if you think you may need help?
Yeah, great question. And I really do appreciate, first of all, you citing those statistics, because this is something that we have dealt with previous, or I call pre-COVID. However, we've seen as clinicians, as psychiatrists, as providers, that the rate of suicide has really increased in regards to the consequences or casualties, depression, anxiety. And as you mentioned with this individual who just tragically and sadly completed the act on Facebook, we have veterans who are also at higher risk. So we do see this on the day-to-day. And just to add to that statistical report that you gave, every 12 minutes, somebody completes suicide. And this is very sobering. And this is why I do, again, appreciate you inviting me here today to talk. It's a very important subject to us statewide as well as nationally.
The numbers really are just jaw-dropping when you think about it, and the stories are just heartbreaking. Why do you think we are seeing this rise right now? Depression playing a role because of the pandemic, jobs lost? Are there certain key factors?
Absolutely. Absolutely. Depression plays a role. We have a significant increase, as we all know, in social distancing, which is important to do, of course. But with that, unfortunately, can come further isolation. People can go on to develop hopelessness, helplessness. We also have to look at the rise of substance use. We have people who have been sober, for example, for many years, but because of these stressors, they have unfortunately relapsed. So in addition to the volitional completed suicidal acts, we also have those people that have overdosed, if you will, in an accidental manner because they have relapsed and their body has not been used to those substances during that period of sobriety. So they're at higher risk of actually, dying during that period of relapse.
You talk about some of those risk factors in the people who may be more succumb to something like this. Depression, though, I think for most people say it's normal. I'm feeling a little sad. Where's the slippery slope? How do you know you need help or you're on the other side of it and someone else may need help?
Yeah, I mean, that's a great question, Tess. And I think that's really the crux of the situation, in where we want to make sure that sometimes we can have appropriate sadness. We can have appropriate feelings during COVID. And I think we all need to realize what appropriate is or expected versus clinical depression, which can lead to these types of things we're talking about today. So we want to look at significant changes in behavior. We want to look at changes in our daily routine. Are we decreasing what we call our self-care? Are we not showering? Are we not getting out of bed every day? Are we increasing social isolation even above and beyond what might be expected during COVID? And I think that it's very important for us to check in with our loved ones. Go to people that you trust. You can actually call. We have suicide hotlines as well. Hopefully, though, with these types of warning signs, we can be very vigilant about. We can prevent it leading to suicide completion and thoughts of suicide.
Important to know those warning signs because we see changes. We know everything is different right now, but even with our teenagers, we're seeing that problem. So hopefully sharing some of this information out there and getting the word out will make a difference and save a life.
Absolutely.
Thank you so much, Dr. Raby, for joining us.
Thank you. I appreciate that. Thank you, Tess.
If you or a loved one is perhaps having thoughts of taking your own life, there is help out there. We want to remind everybody you are not alone. You can call the National Suicide Prevention Lifeline, that number there on your screen. I posted this as well on my Facebook page. Share it, save this number, and just, again, know you are not alone.